Welcome to Savvy Business, Life Unscripted, with your host, Christina Rivera, where our guests share their wisdom and valuable business tips, empowering our audience to expand their personal potential.
Well, welcome, Dr. Stephen Eisenberg. I'm so grateful to have you here today on Savvy Broadcasting. You're known, AKA, as a singing oncologist. And of course, as you just said, the author of Love is the Strongest Medicine. And it really is, especially when you're going through the toughest times. I've had some really close friends dealing with cancer myself. 1 year, I kid you not, Dr. Eisenberg, I had 8 people in my family who were diagnosed with cancer. Nuts.
Yeah.
Yeah.
Yeah. We're all touched by it. Everyone's touched by it in some way.
Yeah.
It's really, it's so pervasive, but when we can come together and surround ourselves with love, it's going to make a huge difference.
Now tell me, as I know each doctor goes into medical school and then you become an intern. You start going through the different rounds of, okay, I'm going to study a little bit of this. You go through different series of types of medicine, and then you make your final choice. And you chose not only oncology but hematology, the blood, working with blood disorders. I was like, well,
Yeah.
that's interesting. So what kind of narrowed you in and focusing on those two areas?
Yeah. Great question, Christina. It was the patience. It was the
Mm,
patience that the conversations I was having with beautiful human beings going through this really scary
mm,
time. I kept discovering over and over that those 3 words, "you have cancer," were so life altering,
mm,
and it was throwing people into an immediate post-traumatic stress experience.
mhm.
Your life changes so quickly. You start thinking about your future and you start giving yourself this expiration date. You say, well, how long do I have, doc?
Mhm.
And it was blowing me away. It was
Yeah.
like just those 3 words would
Yeah.
open up a world of communication
Mm,
and connection,
mhm,
because
mhm.
it was like every single word out of my mouth as the doctor became so vital. It became so
Mhm.
uh, life and death.
Yeah.
One word can give someone hope or it can take it away.
Yeah. Yeah. And you have a lot of responsibility as a doctor and oncologist with that, because people are like, well, how long do I have? I'm like, well, I don't want to give you a date per se because, I don't know. I mean, there's some people who've had stage 4 cancer of some sort and have gotten to full recovery even when it seems like not possible.
Yeah.
Uh,
The first thing I say is, listen, there are statistics and they're useful in many ways. They're useful. But the first thing I want you to know
mhm,
is you are not a statistic.
mhm,
You are Christina. You are Mrs. Johnson. You are a unique human being,
mhm,
and there's always outliers.
mhm,
There's always miracles.
mhm,
There's always things that we don't understand in
mhm.
medicine.
Yeah.
And statistics are useful, but you are not a statistic. Everyone listening to this today, the first thing I want you to know is that you are not a statistic as well. You can beat the odds, and remember that as you go through whatever you're going through. And
Mm.
love is the strongest medicine is part of that. It's
Yeah.
surrounding yourself with people who love you unconditionally and allow you to be yourself through this. You don't
Mm.
have to be perfect
Mm-mm.
going through cancer treatment.
Mm-mm.
Just
Yeah.
express yourself and be who you are and say what you need to say, express what you need to express.
Mm.
You have to let those emotions.
People think they have all the time in the world. I'll get started on going on that trip I really want to do next year. But we really don't know when our time here is over. And it doesn't mean that you get cancer or not get cancer, but really, when you hear those 3 words, it makes you realize just how short life is and to not take for granted the life you have.
Yes, and that message is
Mhm.
is in front of us as people who work in oncology,
Mhm.
the doctors, the nurses, the patients, the caregivers,
Mm,
it's in front of us every minute. And that's one thing my patients have continually taught me over the last 25 years of doing this work,
mm,
is that they keep teaching me every single day, come back to the present. The
mm,
past is over. The future is never going to really be here,
mhm.
because when you think you're in the future, you're back to the present
Yeah.
again. You can only experience life right now.
Mhm.
And so I always say, give up the blame game. Whatever happened, happened. And here we are. We're dealing with what we're dealing with, whether it's cancer or another chronic illness of any kind.
Yeah.
We're here.
Yeah.
So now we take the next steps. We take, what can we do today? What's the next right thing we can do right now
Mhm.
to make a little difference, to make a little dent in this thing? And maybe, just maybe, you'll feel 1% better than you did yesterday. If we
Yeah.
just focus on those little teeny shifts,
Mm. Yeah.
and then it can all add up. And maybe
Mhm.
in 6 months,
Yeah.
just maybe you're all better.
Yeah. See, that's what's amazing about what you're saying there, Dr. Eisenberg, is that really, even let's say it's not even dealing with cancer, let's say it's something, another life altering. You've got a huge divorce. It was 20-year marriage, something like that. It feels unsurmountable when you're going through it. But the deal is, it's a one step in front of the other, day by day process. And you look back and you're like, okay, my life is better now. We're happier that we're apart, or, I'm
Yeah.
healthier now, or whatever it is that, I think people get scared when they see something so big. But then when you approach it, what's just the one thing we're going to do today to be better? Just that one little thing.
Yeah.
Yeah.
Yeah. We feel like it's going to always be this horrible pain we're having, or this side effect from chemo or
Mm.
whatnot. But it will get better. It will
Yeah.
get better day by day. We can do so much that we couldn't do 25 years ago.
Yeah.
There's precision medicine now.
Mhm.
We can test the cancer cells and get the exact mutations which are telling the cells to grow. And we can do so many smart drugs now. So that's the whole, biologics and immunotherapy. That's
Mhm.
called precision oncology. And
Mhm.
we're moving more and more every day to that, and not just blanket give chemo.
Yeah.
It's like, how can we treat your specific cancer cells? What's telling them to grow? What mutations are
Uh-huh.
signaling them? So we're getting much smarter. We still have a long way to go,
Mhm.
but it's night and day from 50 years ago.
Yeah. Now tell me, when you work with a patient, is it empirical in that you just don't, like you said, it's not just the chemotherapy? Do you look at the whole lifestyle and say, let's see about, do you have things unforgiven? Are you looking at the spirit? Like, how do you work with your patient?
Yes,
Mhm.
beautiful question. Well, I see, I look at the mind, body, and soul.
Mhm.
And, we have to realize that the mind body connection is vital. And we've got to sort of turn that around. Many times it's fighting against us,
Mhm.
blaming, the stress. The stress takes anything you're going through, and I know from personal experience, makes it 10 to 25 times worse. So if we can take that and use things like meditation,
Mhm.
prayer, yoga, things that we can do, even chair yoga, right? You can do yoga in
Mhm.
your chair, where,
Yeah.
you don't have to be standing up, doing upside down
Mhm.
inversions. You can do gentle yoga even when you're going through cancer treatment. So it's really getting the mind and body and the spirit to be our biggest ally as we're
Mm.
going through this. How do we do that?
Mm.
We treat you as an entire human being. You're not just the lady with lung cancer in room 5. No, you're Mrs. Johnson, who has 5 children, who was a school teacher, who has unresolved issues with her sister that she hasn't spoken to in 20 years,
Mhm.
who, has a daughter where, maybe she lost a daughter at a young age.
Mm.
These are all unresolved things sometimes,
Mm.
not everybody, but sometimes cancer is a turning point for healing. Sometimes it brings people together. It heals old wounds in families.
Mm.
People rally around and say, let's forget all that stuff from the past. Let's all join together and help Betsy get through this.
Mm-hmm.
And it's a beautiful thing. And I've seen it hundreds of times. Many of those stories are in the book. Love is the strongest medicine, because love is a transformational emotion as we're going through this.
Yeah.
And when we're facing life and death so many times, it brings people together. And when you can get through it and you can get on the other side of it, which many, many patients can, it can be a turning point. And now your whole life is about healing. And now you're eating better, you're exercising better. This was so, in many cases, it's like this crazy form of a wake-up call.
Yeah.
That I need to, thank God I survived, I beat the cancer, and now I'm going to really be in tune with what I can do to be the highest form of me, the healthiest I can be. I'm going to clean up those old relationships that don't work. And I mean, there's so much to being healthy and love, right? Love is, you can break it down into so many things. I like to break it down into 4 letters, LOVE. Listening, observing, verbalizing, and empathizing. Listening to that highest part of ourselves. What do we need? Listening to our hearts, listening to our soul. What does our soul need? That kind of listening. And observing, who are we surrounding ourselves with? Who are we letting into our inner sanctum? Verbalizing from the heart, verbalizing from that highest part, connecting at all costs. And then empathy is truly available. And empathy is also self-compassion, forgiveness.
That's an important part. So many people miss that point. Yeah. Forgiving yourself sometimes.
Forgiving yourself. Oh, I shouldn't have smoked. Oh, I shouldn't have eaten that fast food. Forgiveness of others, but also even most importantly, forgiveness, self-forgiveness.
Yeah.
And that helps you get through it, because again, when you forgive yourself, a lot of that stress, a lot of that blame starts to slowly peel. The layers of the onion start to peel away. And now here you are. You're truly open. You're truly open to healing.
Yeah.
And compassion has been shown to make a big difference.
No, it has.
There's research. There's amazing research around compassion, where if you get the same exact treatment, it's the right treatment for you. It's the right treatment based on data. But one is delivered with beautiful compassion and empathy, and the other's treatment is just flat. The compassion treatment helps. It actually makes a difference. Patients do better.
Yeah.
And there's a lot of research and new and books being written about this. So when I was reading this research, I said, man, I stumbled upon this by writing songs with patients.
Yeah.
But in a way,
now, how did that come about? Because
it was this connection.
Because you love music, but what brought you to decide, okay, I'm going to bring music into therapy? How did that come about?
It was amazing. It was a very personal experience when I was going through a really horrendous time in my life and my career. It was early on as an oncologist. I was getting burned out, and I was trying to be so productive and so successful from a young oncology perspective, building this wonderful, successful practice, that my guitar and my creativity and all the tools that I knew that I wanted to bring to oncology to connect and to make a difference, my guitar was collecting dust in the corner. I entered a story writing contest from my favorite musical artist,
Oh, wow.
Peter Himmelman.
Ah.
He's a wonderful musician, and he had a story writing contest. And the story writing contest was, how has Peter's music impacted you in any way in your life? And the prize was, Peter writes a song for you, an original song.
Aw.
So I wrote about how, as a young doctor in medical school, I would listen to his song, Mission of My Soul, to keep reminding me who I wanted to be. What was my mission of my medicine? That's what I called the story, Mission of My Medicine, based on his song, Mission of My Soul. I won the contest. And wouldn't you know it, Peter wrote a song for me. And in the lyrics were all of the things that I knew that I wanted to be as a doctor, but were getting drained out of me. The day-to-day grind was draining them out of me. And so his song, in many ways, shocked me back to life. It gave me CPR, connection, presence, and resilience. And I was like, hearing what my life was back, and I was crying. I was like, oh my God, I forgot what I wanted to be as an oncologist. It's not about having the most productive, the most successful in terms of outer appearances. It was what I wanted to be on the soul level as an oncologist.
Awesome.
And so after I heard that song, and all the emotions were pouring out of me, and my tears were welling up, and I'm like, this is who I am. I said, I got to do this for patients.
That's awesome.
I have to do this for my patients, to remind them that they are much more than their cancer diagnosis. They're a human being, a beautiful, unique soul who happens to be on this journey, this detour of going through cancer treatment, but it is not the ultimate definition of who they are.
Boom.
And that's the songs. And that to me was love. That to me was love, because I was listening to them. Their highest part of their soul was writing the song with me. Because I ask you as we're writing the song, Christina, how did you meet your husband, or how did you meet your soulmate? What were you like as a kid, Christina? What's your favorite song? What do you love to do when we're done our podcast today? What are you going to do? What brings you the most joy? And those become the lyrics. So I'm listening. I'm observing. I'm observing their body language. I'm observing all the nonverbal cues. I'm saying, like, who's your best friend? Who are you surrounding yourself with? What's your home like? And all of these things become the lyrics. And it's a communication. It's verbalizing from the heart. And then the song is just based on empathy. It's based on who they are, what they want to share with the world, who they want to who they want to be, who they are, what brings them joy, what brings them alive. Oncology ultimately is about living like you said, in the moment. And that's the hardest thing to do for anyone, but especially when you're going through cancer treatment, because again, we many times many patients even ask, well, how long do I have? And I say, well, I'm not God. I can't tell you that. I can give you some rough statistics, but you're not a statistic. Remember that. That was the first thing we said.
It's true.
Yeah. And so that's love. That's love.
It is. And you know what, Dr. Eisenberg, also, we perfectly healthy. Like I said, you could step out of your house, get into your car, and get into a major accident. You never know when your number's up. So live it like boom, today's the only day. Live it to the max. I just love you coming out here today and sharing. Please let everyone know where they can get a copy of Love is the Strongest Medicine. How can they do that?
You can get it anywhere books are sold. It's from Hay House, which is like my dream publisher. Um, and drsteven.com, you can also get it, drsteven.com with a V. That's my website, but it's anywhere, Amazon, anywhere, Barnes and Noble, any bookstore, you can get it. And it just came out. It's brand new, so I'm so excited. It was a #1 Amazon new release for for like under the category of like cancer and but I love what you're saying, because it's really for anybody who's been touched by cancer, but also anyone who really just wants to bring more love and compassion and empathy into their own life.
Absolutely.
And
well,
that's about connection, and I thank you so much for connecting with me here today.
Oh my gosh, Dr. Eisenberg, I'm so grateful you came out to share, because this does not have to be a death sentence. That three letters, you have cancer. It doesn't have to be a death sentence, whether it's someone in your family or yourself. Live for the present, live for the moment, and live to the fullest, because you live your best self. So I thank you for sharing that awesome message of love and empathy.
Yes.
Thank you for coming to Savvy Broadcasting today.
Thank you so much for having me, Christina. And always remember, one of my favorite mentors said to me, never take away anybody's hope.
Absolutely.
Never take away anybody's hope. You do not know what's in store. And there's always hope. There's always hope.
Always.
And so remember that.
Thank you. Thank you, Dr. Eisenberg. You have an awesome day.
Thank you.
Like, subscribe, and share this episode. To listen to more savvy episodes and savvy biz tips, go to www.lifeunscriptedradio.com. To find out about our paid sponsorship opportunities or how to become a guest, email Christina at lifeunscriptedradio.com.